Right now at 6, parents are not backing down on school mask mandates.
We're ready to just continue to put pressure on this stuff. You're not going to just tell us to sit.
Tonight, the latest on what Tri-County Health is deciding for your children.
Tri-County Health really needs to think really hard about what they're doing because we will remember.
Plus, getting a boost to fight COVID-19.
When you get to be my age, you get to be concerned.
The most at-risk Coloradans are getting a third dose of the vaccine.
We're most concerned about a few different subgroups of patients. Older patients who are more likely to have a waning immune response. Second of all, people who are on immunosuppressants.
Tonight, we have in-depth coverage on COVID booster shots and when they could be available for everyone.
Good evening. Thank you for joining us at 6. I'm Shannon Ogden.
And I'm Jacqueline Allen. We start with breaking news at 6. Tri-County Health has voted to remove the opt-out option from its school mask order. Tri-County recommended masks in schools for kids aged 2 to 11. Previously, Douglas County and Adams County commissioners had opted out of the guidance. Arapahoe County is scheduled to meet tomorrow.
And we're going to begin this half hour with Denver7's Gary Brode.
The schools are saying, please, somebody step up and act.
Tri-County Health Commissioners starting the week questioning the need for masks with kids in schools and who should be making the decision, Tri-County, the county, or the districts. Dr. John Douglas with Tri-County Health stressed the need for masks as he wants to avoid kids going back to learning from home.
Part of the trade-off, more masks, less quarantine.
Members of the commission questioned the need for masks when the numbers remain low.
One person per 100,000 in that lower age group. One person in the hospital in all our county, and we're masking 2-year-olds.
Earlier in the day,
we received 18,472 responses.
Arapahoe County commissioners had a special session talking about the possibility of opting out of the mask mandate, leaving it to each school to decide.
55% of respondents support opting out of the public health order.
While Arapahoe County commissioners were discussing the findings of the survey, parents gathered outside the county building.
We wanted to come and put just a little bit of kind pressure, on our commissioners to let them know that us as parents, we want to opt out of the Tri-County mandate.
Believing it should be their decision to put a mask on their kids.
And we don't co-parent with the government. Exactly. The government wasn't there when I spent 105 days in the NICU. The government wasn't there when my son went code blue and I watched him die. The government wasn't there. I was. I went through those experiences with my son, and so I need them to understand that I know what's best for my child.
For Denver7, I'm Gary Brode.
Also, this is late tonight. Tri-County Health also put a new mask policy into place. So masks will now be required for all students 2 years and older.
And even before Tri-County Health's decision, several school districts had decided to keep mask mandates in place on their own, despite county commissioners voting to opt out. Douglas County Schools, Aurora Public Schools, Adams 12, and Adams 14 have all decided to keep those mandates in place.
And 3,600 new COVID cases reported Saturday through today in our state. ICU beds are filling up as well. UC Health, for example, they say they have 98 patients in the ICU right now, and that is the highest number we've seen since early January.
As cases rise and hospital beds dwindle, federal health officials are working to get the public quicker access to booster shots. Today, a CDC panel met to consider booster shots for all eligible Americans. They'll meet again next month. Right now, the CDC says some people who are moderately to severely immunocompromised should get a third dose. This is only for the Pfizer or Moderna vaccine. The CDC says there's not enough data to know if people who got the Johnson & Johnson vaccine should get that second dose. Now today, Boulder County announced immunocompromised people can get their third vaccine in all clinics.
And those third shots are already being distributed in other parts of the metro. And tonight, in-depth coverage on booster shots. And we start with Denver7's Russell Haythorne, who spoke with a Coloradan who recently got that third shot.
For Tom Morris,
You get to be 82, things happen.
the COVID-19 booster is a no-brainer.
I have ulcerative colitis, I have COPD, asthma, high blood pressure.
Even if you're getting vaccinated.
And researchers like Dr. Mike Wexler at National Jewish Health.
So it'll be interesting to see whether you've mounted a response from your prior 2 shots.
Are grateful for patients like Morris.
We're most concerned about a few different subgroups of patients. Older patients who are more likely to have a waning immune response. Second of all, people who are on immunosuppressants, less likely to continue to make antibodies.
Wexler and his team are conducting a study to see how certain patients are responding to the COVID vaccine and the booster. Their research is already revealing
as many as 25% of people in whom we've checked antibodies have low levels or no levels of antibodies. And so those are the people we're most concerned about. And then people with chronic medical conditions.
Whether the booster is having a huge impact is still debatable. What those like Dr. Steve Frankel do know is that it is recommended for the immunosuppressed.
Those are people who have had solid organ transplants, kidney transplants, liver transplants, lung transplants.
As you may have read, it's simply another dose of the same vaccine.
But if you think about when you were a kid, that's how you got vaccines.
At the moment, doctors recommend getting the same one, not mixing and matching.
If you receive Moderna, it would be a third dose of Moderna.
For those who got the J&J vaccine, there's still no official recommendation on a second dose. It's also not official if a third dose of Pfizer or Moderna will be recommended for all.
Well, that's a bigger question because if your immune system works pretty well, you're probably pretty good with the 2 doses.
And finally, it's also still unclear whether the booster will be like an annual flu shot.
It's a moving target in the sense that, is it the kind of thing where every year, every 2 years, every 5 years, they need to change the formula a little bit? Is it that, oh, you get 2 or 3 shots now and we're done? We don't know.
Which brings us back to that vaccine responsiveness study Tom Morris is happy to be volunteering for.
Oh, I would love to get an antibody test. I've never had one. It's not about me much because I'm 82 and I could go any minute, you know.
As doctors continue their research on the unknown.
What's the cause of the breakthrough infections?
Russell Haythorne, Denver7.
And we heard back from Health One today. They say there will not be those public clinics for the booster shots like we first saw. They say you should instead visit your pharmacy or other local clinic.
Booster shots could help keep borders open across the world. Today, the European Union recommended its 27 nations reinstate restrictions on U.S. tourists. Right now, it's not clear what the CDC will say about whether vaccinated people should get boosters before travel. Under the current guidance, fully vaccinated people can travel 2 weeks after their second shot. If you are traveling to an area with a high rate of COVID-19 transmission, it is recommended you get a booster, then wait 2 weeks before traveling. Israel is currently battling its 4th wave of COVID-19. It's become the first country to offer booster shots to those over 12 years old. So far, just over 1/5 of the population has received a 3rd dose of the vaccine.
Well, approval of the booster shots for all will come when many people are getting their flu shot. So, is it safe to get your COVID booster and the flu shot at the same time? Well, we asked a pediatric physician at Children's Hospital.
Yeah, so currently the recommendation is you can get the COVID shot with your flu shot or any other shot for that matter. And so we would encourage you, if you are going for your COVID shot and the flu shot's available, you should get both or vice versa if you're eligible.
Now, doctors say it is possible to be infected with multiple viruses at the same time. And of course, it's not uncommon for vaccines to require several doses. Vaccinations for hepatitis B and HPV require a 3rd dose after 6 months. The shingles vaccine comes in 2 doses, separated by 6 months.
The city of Colorado Springs will pay a black man $65,000 after he was allegedly racially profiled by 3 police officers. This stems from an incident in 2018 in which police were looking for a 15-year-old suspect.
Chance back for me, bud. I'm just trying to figure out who you are, man. We're looking for somebody and you might match the description, but you're not saying who you are.
The ACLU filed a lawsuit against the city on behalf of 29-year-old Corey Barnes. The suit says Barnes matched none of the descriptors of the original suspect except for his skin tone. Officers handcuffed and illegally searched Barnes despite being heard on camera admitting they have the wrong guy.
Nope, this isn't who you're looking for? Okay, thank you.
The ACLU says officers wrote misleading statements in reports that suggested they released Barnes when they learned he was not the suspect. In addition to the settlement money, the Colorado Springs Police Department agreed to train all active police officers on the legality of so-called stop and frisk encounters. Denver is expanding its STAR program after a successful 1-year pilot. This program is aimed at diverting certain emergency calls away from police and towards mental health professionals. In July, Denver City Council approved $1 million to fund the program.
Colorado Secretary of State is moving forward with plans to prevent Mesa County Clerk and Recorder Tina Peters from overseeing November's elections. Now, this comes as an investigation continues into how secret passwords of Mesa County's election equipment were leaked online. Secretary of State Jenna Griswold filed a lawsuit to appoint Wayne Williams in place of Peters and Sheila Reiner as the Director of Elections. Now, Williams is former Secretary of State. Reiner is the current Mesa County Treasurer and former County Clerk. Today, Griswold said it's the only way to ensure a safe election.
The circumstances in Mesa County are incredibly drastic. We have a county clerk who was elected to uphold the election rules and election law in Colorado to ensure the residents can cast ballots in safe and secure elections, who let an internal security breach happen, compromising the voting equipment and forcing me to decertify the voting equipment in Mesa County.
Warrants obtained by Denver7 show the district attorney wants access to Peter's cell phones, as well as logs and social media communications and video surveillance. The FBI is also investigating.
A new wildfire in an area of our state ravaged by fires in the past.
It's just a constant reminder up here that we live in wildfire country. That fire last year was extremely devastating.
Tonight, how Grant County is working to prevent a repeat of last year.
Back to the middle 90s today, another hot one tomorrow, but then a big change by Thursday and Friday.